Hello, everyone, and thank you for joining today's webinar, Families of Children with Neurodevelopmental Disabilities, Lessons Learned from COVID-19. Before we get started, I'd like to go over a few housekeeping items so that you know how to participate in today's event. To the right of your screen is the control panel. As an attendee, you have the option of listening in using your computer or by phone. To switch from computer audio to phone, just select telephone in the audio panel and follow the dial-in instructions. If you're having trouble hearing me, please send a message through the questions pane and we will assist you. For today's session, we've shared some materials in the handouts panel. You can download these materials at any time. Also, at the end of today's event, you'll receive a certificate of attendance via email. Since your mic is muted by default, you can submit questions to our presenters by typing them into the chat pane at any time. We will hold off on answering any questions until the end of the presentation. Since most of you are here now, let's get started. To those of you who just joined us, good afternoon and welcome to today's webinar, Families of Children with Neurodevelopmental Disabilities, Lessons Learned from COVID-19. My name is Lindsay Malari, and I am your host for today's event. It's great to have you all today. I have the distinct pleasure of introducing today's speakers, Dr. Priyanka Fernandes, Dr. Denise Nunez, and Dr. Candace Gragnani. Dr. Priyanka Fernandes is a clinical instructor in the Department of Medicine and is Associate Program Director for the Preventative Medicine Fellowship at UCLA. Her special interests are in infection control, preventative medicine, and community-based prevention programs. Dr. Candace Gragnani is an Associate Physician Diplomat in the Child Health Policy Program of the Department of Pediatrics at the UCLA School of Medicine and is on faculty for the UCLA Preventative Medicine Program. Her research interests include improving healthcare access and outcomes for underserved and at-risk communities. Dr. Denise Nunez is a general pediatrician and critical care physician. She works with families on prevention health at UCLA. Previously, Nunez helped pioneer Chicago Medical School's first free clinic. So without further ado, I'll turn it over to Dr. Denise Nunez. Take it away.
Hello, everyone. Can you hear me well? Is the sound coming through okay?
Great, thank you.
Thank you. All right. Well, welcome everyone. It's our pleasure to speak with all of you either this morning, afternoon, or even evening, depending on your time zones, since all time zones are welcome at our talk. And we're proud to have your interest and your time to share the details of our study, the impact of COVID-19 on families of children with developmental disabilities. And we'll begin with Dr. Candace Gragnani, who is a beloved pediatrician and preventive medicine physician here at our Prev Med department at UCLA to begin our discussion.
Thank you, Denise. Can you go ahead and go to the next slide, please? So today, we're going to walk through a little bit of background of COVID-19 first to get us all in the frame of mind to discuss the very important information that we've gathered through this project that we've worked on to really work with families and get some more nuanced and really hearty insight into the struggles that they've experienced throughout the COVID-19 pandemic in terms of being able to support and provide access to resources for children with neurodevelopmental disabilities. So I'll go ahead and give a background intro, and then Dr. Nunez and Dr. Fernandes will walk you guys through how they structured the study, what the results were, and focus in on what the implications and conclusions that we can reach are based off of our research. So next slide, please. So a little bit of background. Next slide, please. COVID-19 has obviously impacted all of us in kind of overwhelming and all-encompassing ways, right? Not one of us has been untouched by this global pandemic. And I think what can be helpful when we're thinking about discussing, impacts on particular populations who are already at higher risk who are underserved and who are inequitably served by a lot of structures that exist both socially and in the healthcare system and politically as well, right? What can be helpful is to kind of take a bird's eye view of how a lot of individuals, the general population, has been affected, and then really hone in to focus on more specific issues, more specific points for advocacy, more specific problems that parents, caregivers, cousins, aunties, whoever's involved in children's lives who are neurodiverse, right, what they have been going throughout the COVID-19 pandemic. So in terms of COVID-19, it's been, almost a couple years now since we've been dealing with the COVID-19 pandemic. And on this slide are just kind of a few things that come to mind when I think about, right, how children in particular have been impacted by the global pandemic. And you can think about this from a healthcare standpoint, you can think about it from a home care standpoint, you can think about it from an education standpoint, but quite frankly, right, it all matters because our health, our well-being, both of mind, of body, of spirit, it's all determined by the environments in which we're able to live, function, and access the resources that we need to live our best life. So in terms of kind of what children have encountered, right, throughout the pandemic, there's a lot of research that's come out over the last year in particular, trying to garner more quantitative data on, what has happened since the world sort of shut down, right, for a vast period of time. And from a purely healthcare standpoint, some of the issues that people ran into were just difficulty in accessing well childcare, right? So you can imagine that for parents, particularly of neurodiverse children or children who have any sort of developmental or physical disability, it became increasingly difficult to feel safe to be coming into a clinical environment, particularly at the beginning of the pandemic, right, when we didn't have as much information or knowledge, when there weren't as many clear guidelines in terms of personal protective equipment or, infection prevention policies, and when we didn't have vaccines. So you can imagine it was very hard for parents to decide, whether or not it was worth trying to venture out into the pediatrician's office for regular well child care or even for some acute needs, right? And so that ended up resulting in a lot of delays in routine childhood vaccination. So that, for the most part, we've been working on, and I think overcoming a lot of those issues and are on a better track now. But that was another issue that came up for children during the COVID-19 pandemic. And then when we think about school shutdowns, right, schools are such key centers for family-based support and care and for the growth and development of children. So it's not only educational losses that children experience when schools are shut down, it's lost opportunities for play, for socialization. For some children, school is a very safe place when home, depending on the neighborhood, right, the environment that children live in. Sometimes school is like one of the safest places they get to be and play. So that was a huge loss for a lot of children. A lot of children, particularly with neurodevelopmental needs, and disabilities, also receive really important services at school, whether that's occupational therapy, speech therapy, extra additional support based off of individualized educational plans, right? So children were not only missing out on those services for X period of time, but a lot of children were unable to be assessed for their needs during this period of time. As we all know, or the early years in childhood are such a critical time for development and gains when we do identify issues. And so we've lost time to help support a lot of children in, learning how to work around issues that they may come up when they're learning or playing or socializing with others. And then family losses is another one that I wanted to point out. So not only, right, losses in employment, losses in financial stability, losses in housing, but losses of family members, right? Hundreds of thousands, if not millions of children have been lost or have had loved ones lost during the COVID-19 pandemic. So all important things to kind of keep in mind when we're talking about kids during COVID-19. Next slide, please. So focusing in a little bit more on this idea of family loss, right? So Kaiser Family Foundation tried to quantify a little bit of this last year, kind of during the first really big round of the pandemic when a lot of things were shut down, in terms of trying to quantify, right, how have households with children, in particular, been experiencing problems meeting their needs during the pandemic? And this is outside of any other needs that the family might have, right? So this is just looking at very, very basic needs, but you can see 51% experience some loss of income. So over half of all households with children in the United States experience some sort of income loss. In the beginning of the pandemic, 38%, it was hard for them to pay for usual household expenses. 12% had insufficient food, right? and a third were not confident that they could pay their rent the next month. So, just thinking about that, think about having a child who is neurodiverse or has neurodevelopmental disabilities, who needs support, access to services, healthcare, right? On top of all of this very real loss and sense of urgency in addressing, what needs to be done just to meet your family's basic needs. Next slide, please. So as we start to think a little bit more concretely about the research project led by Dr. Nunez and Dr. Fernandes, I did want to point out some interesting survey results that were done by kind of a consortium of individuals. It was a questionnaire that was the joint work of AAP, the Centers for Disease Control and Prevention, and Prevent Child Abuse America, and Tufts. And so what they were looking at, they tried to assess kind of, early in the pandemic in November of last year, and then they did a wave 2 in March of this year, right? They wanted to see how are families who are supporting children with special health care needs accessing services. So our research today focuses on children with neurodevelopmental disabilities primarily. This is a little bit of a broader swath in terms of, families who have children with special healthcare needs kind of across the spectrum. So those could be purely physical as well. But if you look at this slide, and then if you go on to the next slide, please. Looking at the wave 2 results, what you can see is that, go back one slide. What you can see is that actually a lot of individuals were able to increasingly access services in this wave 2 of the survey. So between November of 2020 and March of 2021, there was an increase in access to services for children with special healthcare needs in terms of case management, in terms of durable medical equipment, home health services, social work services, special education services, and any service at all. Actually, there was an increase of about 10%, which is reassuring in terms of, right, things are starting to get right back on track. And in terms of trying to get kids back into the services that they need to really thrive and grow. And so with schools reopening, I think that's going to be helping us a lot. But hopefully that gives you kind of a little bit of an overview of what's happened to date in terms of COVID-19. And now I'd like to pass it off to Dr. Nunez to talk more about the study.
Thank you, Candace. And thank you for giving us such a great insight into the background of this issue. You can go to the next slide, please. So our team decided that we really wanted to evaluate the impacts of this pandemic on families of children with special needs and neurodevelopmental disabilities. They're already a vulnerable group, so we wanted to keep track of what was going on with them, what kinds of resources they were able to access, what kinds of issues, and what solutions could be derived from all of that. And so in examining this, we asked families who had children who had diagnosed or suspected diagnoses of diagnoses such as attention deficit disorder or ADHD, attention deficit and hyperactivity disorder or ADHD, autism spectrum disorder, also called ASD, any kind of vision loss, hearing loss, or intellectual disabilities, among others. And the thing, just as Dr. Gragnani said, these children tend to need access to essential services that help them to develop during a very critical time. Some of these children need this to access their full potential physically and academically and otherwise. So having a lack or any gap in these services can be quite devastating depending on the diagnosis and the course for these young children. Service access was really important to see if it was being protected, if it needed to be improved, which we anticipated would happen with this pandemic. Service access as a whole is already among the many challenges that these families are dealing with even before the pandemic. So with the challenge of it, we knew that this had the potential to be quite devastating for some families. Services that these families are accessing are even more vulnerable to systemic changes, such as a global pandemic, but for any kind of large systemic change or emergency that might occur. So with our study, we intended to derive all this information and then again, provide potential tools and resources to the greater population with children with special needs, but then otherwise, because the general population of children can benefit from getting any additional supports if identified. Thank you. You can move on to the next slide. So our study design consisted of 3 major elements. The talk for today is mainly focused on the first piece, which is the longitudinal survey for families. So for families that we targeted with these children that have special needs, we provided an online survey via REDCap to ask them a variety of questions to assess their household situation, how their services were going, and then the perceived impacts of changes due to COVID-19. And this survey was distributed electronically to our recruited families from November 2020 all the way up to February 2021. And so our discussion will be focused on the survey results, on the initial survey results. But we also had other parts going on in our study that we'll be able to provide information for. So our second piece was to get a holistic view of the issues with services by talking to the providers, doctors, practitioners, therapists, et cetera, that are providing services to these children to get their perspective of what was going on the service side. And so they received an electronic survey, and they were also given the opportunity to meet as a group to discuss their experiences. And then the final element was intended to combine the findings of our family evaluations and our provider evaluations into an intervention. So we created an event, which is we called an interactive forum, where we invited families and providers to have a greater discussion and talk about these solutions and issues and plan for the future. And we collaborated with a community partner known as Jewels of Youth or the Joy Foundation. And families were able to attend in person or virtually. And then resources, services, and solutions, including emergency preparedness guidance, were provided during this forum. Thank you. Next slide. So our intent was to understand the economic, educational, and health challenges experienced by our families during the pandemic. We also chose to explore the family unit characteristics and to evaluate their potential predictive value of these challenges. So getting a sense of what's the family interaction, what are characteristics of the family unit overall, and how they interfaced with some of these challenges. And finally, we wanted to clarify where interventions are warranted and create opportunities for these interventions to improve the lives of these families. Next slide. So these methods, again, refer to our first element, the family-directed longitudinal survey. We recruited participants through a variety of methods to help reduce the challenge of remote and virtual-based recruitment methods. It's already difficult enough to recruit, but doing this virtually can be quite challenging. And so I listed here the top 3, which were virtual clinics. So we worked with the UCLA LEND and UC Riverside Clinic, which is a clinic where families go to discuss transitions, access to services, and get a better view of how to improve their child with special needs and their situation. And so we had study members be in a virtual lobby where they could interact with some of the patients as they came in, discuss the study, and invite them to join if they felt it was useful or something that they would like to do. And so we got a large amount of patients from the UCLA LEND clinic, actually. We also recruited through the UCLA MedPeds clinics, and we used the virtual flyers in this measure. We did not have a team member present at their clinics to recruit virtually. And then we used social media websites, online blogs, so-called mommy blogs for families with children of special needs, and we provided virtual flyers there to give them information to join us. We also recruited via regional center emails. The American Academy of Pediatrics Chapter 2 provided these flyers, and there were other additional community groups that shared these flyers with their members. And those who opted into our survey were given a $25 gift card at the completion of the survey. And again, the time frame was last year in November up to this year, February, and we have a follow-up survey planned to be given to the families this coming month into November. Next slide. So this slide is to show the structure of our survey. It's basically the 4 different pieces that our families encountered while they took the survey. So the first part was demographics. We asked questions about the family demographics and then also specifics about the children with special needs. And we used information and questions from the US Census to craft our demographics. And then we had the service access section. So we asked about overall all the children that were receiving services, and then we focused more on the children who had special needs and the services that they were receiving. And we explored frequency and intensity of these services, which we'll talk a little bit about in the next slide. And then also asked if there was any impression that COVID-19 provoked any kind of changes that they experienced with these services. Then we had family scales. So these were pre-validated scales to get a sense of the family environment, to see how family members were interacting with each other during the pandemic and overall. And then finally, we asked questions specific to COVID-19 behaviors, perceptions, physical health changes, and mental health changes, among other things, which we'll show you as we move along. Next slide. So for the details of the questionnaire, we just wanted to provide a list of the resources that we used to craft our survey. So again, we used the US Census for the demographic information. We also used the National Survey for Children with Special Health Care Needs and the Autism Services Survey to get questions directed towards services, service difficulties. And then we accessed the LAUSD website, which is the academic Center for the LA County, to get a comprehensive list of all of the resources that children are receiving through the county, so we could ask about those. Next slide. And so just for you all to review, we wanted to provide some examples of the questions that our families were answering. So for the service access questions, one example is this one. So does your child or do your children with special health care needs currently need any of the following therapy services? And then we listed therapy services, medical services, and social services. And the families were able to select which ones applied to their child with special needs. And once they identified which were the services, we asked more specific questions about that service. So for example, have you had any difficulty accessing the therapies listed? And more details about that specific service in how long have they been receiving it in months, how many times per week, if it was a weekly service, how many days per month, and then the length of the session in minutes, just to know how intense that service was, if it was a new service or a service that was being provided to the child over time. For the COVID-19 questionnaire, so we had several types of questions, but the main questions for COVID-19 were Likert scale questions that were 5 points from strongly disagree to strongly agree. And the first one is an example of that type of question. So we asked families to see how they agreed with this question, such as, I have a greater difficulty in managing my child's behaviors since the COVID-19 related changes. And so they could select how much they agreed or disagreed with that statement. And then we also had questions that were more free response, as the one below, just to get a better assessment of their experiences with things. So for example, during the pandemic, how has the physical health of your child with special needs been affected? And we allowed them to elaborate if necessary, and if there was information available at the time. Next slide. And so these are questions from our validated surveys, and these were surveys that we used, again, to get a better sense of the family situation, the family environment overall and during this time. So for the family environment survey, this is a list of 100 statements that a family member would answer either true or false about their family. And so here are 2 examples. Family members really help and support one another, true or false. We fight a lot in our family, true or false. And then there are validated measures to score this to get a sense of the family environment. For the next one, which is the perceived social support, these were 12 items, 12 statements, and they had Likert scales as well. It was a 7-point Likert scale from very strongly disagree to very strongly agree. And there were questions or statements such as, you can't get away with much in our family, or we are really not encouraged to speak up for ourselves in our family. And then finally, for parental sense of competence, this was a 17-item scale with a 5-point Likert scale from strongly agree to strongly disagree. And parents were asked, or providers were asked, sometimes I feel like I'm not getting anything done, or a difficult problem in being a parent is not knowing when you're doing a good job or a bad one. And so learning about their family environment, knowing about how the parents feel competent, their level of competence, and then how much support they feel that they're receiving within and with outside of their families in their local networks really helped us to get a sense of what our families were going through during this time. All right, next slide. So now we'll move on to the findings of our results, which I will invite our pediatric infectious disease and preventive medicine physician, Priyanka Fernandes, to share the details. But before we begin on that, we'd like to share a poll with you of one of the questions that we provided to our families to see what you experienced. And so we'll go ahead and open up that poll and invite our next speaker. So here's the poll. Which of the following issues do you believe had the most impact on families during the pandemic? Was it mental health issues, physical health issues, financial issues, child care issues, or child behavioral issues? So select which one you think had the most impact on our families during the pandemic. And we will be sharing with you what our family said, so stay tuned. And I'll give you a few moments. So which one do you think out of these 5, if families as a whole, it could be thinking about an individual like a parent, but you can definitely view it as a whole if there were mental issues that emerged or got more difficult, physical health issues that emerged or became more difficult, along with financial, child's care, and the behaviors of a child. And think about this in the context of a home with a child of special needs. Great, so here are our results. It appears that our attendees believe that child behavior was probably the leading issue, but it really seems like financial is also concerning, that has caused an issue to our families, along with child's care and mental health. So thank you for voting. I'm glad to hear and see your views, see more than hear. And we will pass it over to Dr. Fernandes so we can continue on the results, and we will share with you what our family said. Thank you.
Thank you, Denise. We'll go ahead and get to our results. I'm just making sure I can advance the slides. All right. So I just wanted to give you first, before we get into the nitty-gritty of the results, the composition of our sample size, because it was a little unique and challenging during recruitment in the midst of a pandemic, as Denise highlighted that all of this was done virtually, and it was done at a time where the surge, so to speak, in LA was at its maximum, and therefore I think we had representation from very specific populations. So around 40% were from the UCLA primary care clinics. Oh, I should mention the total number of responses we got were from 54 family members. So almost 40% were from our primary care providers, both pediatrics and medicine pediatrics clinics in the health system. About a quarter of them were from the LEN clinics and the neurology clinic here at UCLA. There are more subspecialty type of clinic. And then we received around 30% from outside of UCLA system, one from the Riverside LEN clinic, and then because of the catchment or the recruitment strategies, through the AAP, the American Academy of Pediatrics, we were able to get some like few clinics around the area, Southern California area, and then also used social media. So that was a breakdown of our sample size. So you can already imagine that there may be specific characteristics that we can attribute because of this sample. Getting into details about this are very table heavy, so I will try and guide you through important results with this cursor of mine. So the survey was meant for the parent to complete, or like the caregiver to complete on behalf of the family. So while the child was at the crux of the questioning, we wanted to understand the family unit as a whole. So a lot of questions, as Denise alluded to, were getting at that. And I would just encourage you to think of that in how the questions were answered, because some of the demographic information gets at the family level and not necessarily the child who was affected. So most of the respondents were parents of children with special needs, or with a large focus on developmental disabilities, because that's a particular patient population we were interested in, given that they have I would say like a unique set of services or set of needs that they have compared to the larger children with special needs. So those with children with developmental disabilities was a major focus of the recruitment. Most of the families had one child who was affected, and the household size was of 4. So they probably had a second child or another household member who lived with them. Our representation was not the best in terms of representing the Los Angeles County demographic. So we had a lower number of Hispanic representation. It's closer to 45 or 50% for the most recent census data for LA County. And we had a heavier white representation of 60.4%. Also, in terms of the education level of the respondent answering this particular survey, we had families with higher, with caregivers who were highly educated. So 40% had master's degree or higher, and 50% had at least an associate or bachelor's degree. So again, skewing the population to a more skewing the sample to a more educated population. And then in terms of marital status, 77% were married, and you can see the breakdown of the other findings as well down here. Some of these demographic questions get at the economic background or financial background of the family. We asked about health insurance, and most of our patients were privately insured, as you can see, 3/4 of the population of the sample. And then in terms of the employment status, Candace pointed out that there was a lot of economic loss early on in the pandemic. This was not necessarily very early on that we conducted the survey. It was in the middle of the pandemic, but a big surge in LA County, representing a big surge in LA County. But you can see we didn't have too much job loss compared to some other surveys, again pointing to a more economically stable and economically well-to-do sample that we recruited through this virtual platform. Many of them had a remote work option. Not many had applied for the unemployment insurance that was available or had social security benefits. And the household income skewed, again, much higher in this population. In terms of the educational need of that, the child on whose behalf the caregiver was answering, we found that the majority were male sex, and the median age was 9 years of age. We had the different diagnoses outlined here. You can select, you could select more than one option. And as you can see, we had many autistic children and those who were diagnosed with ADD or ADHD. In terms of the educational needs through the schools, 37 out of 54 had an individualized education plan in place, and most of them were receiving the class delivery remotely. And then the school-based services that were most frequently being offered to this sample were speech and language services, and then a smattering of counseling services, special classes, and behavioral intervention. So these are the services that were offered through the school. When we asked about the satisfaction of the current educational environment, so at the time when the survey was being conducted, it was interesting to see that, I mean, we had a split in those who were satisfied versus unsatisfied. I guess it's depending what you're comparing it to, whether you're comparing it to your pre-pandemic educational environment versus not having any educational environment. So it's like looking at it half glass full, half glass empty. And then a lot, the majority attributed the change in their satisfaction was related indeed to COVID-19. This is a small number in terms of increased satisfaction related to COVID-19, but I think it's important to note because there may be, or at least we've heard in our clinical setting as well, that there may be individuals who really prefer this remote set of learning, remote environment of learning, and we should probably look into this some more moving ahead. Oh, sorry, there's a lag. We then broke down the service need based on the services that, again, Denise mentioned about this. These are services not only through school, but services outside of school as well. So looking at social services, medical services, and therapy sort of services. And this is not an exhaustive list, but just shows what our sample most frequently chose. So most of the, or a large number were in the social services, were receiving respite care and day programs, were enrolled in those programs, and a significant portion experienced difficulties during the pandemic in accessing those. The medical services compared to social services and therapy services, as you can see, this number is 44% versus almost 60% and almost 90% here. Experienced difficulties in accessing medical services. So it seems like for them, while there were difficulties, it was not as impacted as some of these other services. and psychiatry and psychotherapy were the ones which were most commonly chosen. In terms of other therapy services, speech and language and occupational therapy services were the most common services utilized by families, and also they had the highest proportion of having difficulties accessing those services. This table and these sets of questions got at the direct impacts of COVID-19 on families. So looking at whether the household that was answering the question knew of a person in the household, or like had a household member who was diagnosed with COVID-19, and whether they knew of any death due to COVID-19. And we can see less than 25% had a member of their family at the time, at least, who was diagnosed with COVID-19. So I think this points to the fact as well, this particular population was probably more privileged in being able to work from home, or also having different kinds of work environments. And in terms of the question that was asked during the poll, we asked our families here as well, but the difference was that they were able to choose more than one response, whereas you all were asked to choose one response. But we can see here that child behavior difficulties was one thing that most families struggle with, followed by mental issues within the family itself, the family unit. This didn't get at one particular member of the family, it got at the whole family. And while no one chose physical issues, quite a bit, a portion of the sample chose that as an issue as well. And less than 50% chose financial issues, but higher than the number in our audience. In terms of vaccinating their child, again, remember this was very early in the vaccine conversation and delivery. There was quite a large proportion, so 77%, who would consider vaccinating their child. And around half of the sample had an emergency preparedness plan, but less than half accounted for those with special needs. Moving to the next slide, we asked some open-ended questions. I think asking some open-ended questions allows you to put a real context to the numbers that we look at, because it makes the numbers speak and numbers more real, and brings the family stories out more clearly. So some of the themes that we got from these qualitative questions are related to recommendations for service improvement from the perspective of family members. So they were talking about training teachers in using the virtual environment a little more effectively, evaluations of, again, the teachers, so that, resuming evaluations of the children, because those were significantly delayed. And then I will not read the whole question, the whole response, because it's pretty long, but it's out here for you to read in terms of the recommendations of service improvement. There were some quotes also related to what parents found successful with obtaining services for themselves. So many had the resources and the ability to get private services and have access to better teachers. And then advocacy from their perspective, families getting more involved in advocating for their family, for their children, and for their educational rights. And as you can see, I've become a bulldog to advocate for my kids. So family members getting more involved in that space. Talking about physical health and like coping strategies, again, our population was able to, get access to potentially higher level of mental health resources and like just access to space where you can be physically active, while that might not have been the case for many of the families who were affected during COVID-19. So we did, Denise did mention about trying to understand from the family perspective if there were any predictors of the family unit, either economical or just structure-wise, that we can look into that may have predicted who had more challenges versus others. And it shows here that at least it's a prelim analysis that we have here. This shows that marital status may have played a role to some degree in those who experience difficulties versus those who did not experience difficulties in accessing services. I've been a little liberal here because this is a bivariate analysis. It's not a multivariate analysis for the audience members who don't necessarily deal with p-values on a daily basis. This number if it's less than 0.05 is when you think it's considered significant. Here, because it's prelim analysis, we were considering a p-value of 0.15 or less as like pointing to a trend of significance. Having a work from home option did not necessarily stand out in this as a predictor in our sample. And then the type of insurance you had didn't necessarily affect whether you had challenges or not. Family income, so household income did affect whether you had challenges or not in our sample. And then getting at the validated surveys down here, the parental perceived social support means were kind of similar between the two groups, that is those who experienced difficulties versus those who did not. And it was not statistically significant. Similarly, for the parental sense of competence, it was higher than 0.15, so questionable significance here. Just talking a little bit about the family environment scale, there are 10, I think, what do they call it, subscales within the family environment scale, and divided into like 3 domains. And we didn't find significance in all 10 subdomains, but 4 of them you could see some trends, and 2 of them potentially significantly. So those families which had better cohesion, allowed their family members to express better or express more, had lesser challenges. And then those with moral, religious emphasis, or had a very structured organization in terms of their activities at home, also tended to have lower challenges. This is again prelim analysis, only bivariate, so additional analysis has to be done to see if these really play out. So coming to the limitations, again, we mentioned about the recruitment method. It was an online only survey and online only recruitment. So it was a little challenging to get a good representative sample of the Southern California population, because we felt that if we had to develop interventions, we wanted to focus on that Southern California population because it would probably be more relevant and feasible. And then the recruitment time frame was such that it was most of the responses came between December and February, which was the worst months in LA County in terms of COVID-19 diagnoses and caseload and deaths. So we took longer than expected to recruit families, and we were not able to get a representative sample as well. And then the length of the survey was pretty long. We did offer reimbursement or like incentives, but it was still long. So we saw some drop off in responses over the course of the survey. In terms of some of the conclusions, so our study highlighted that household income may play a larger role than we acknowledge. And I see this because the health, we often talk about access to health care and health insurance, having health insurance as very important drivers of understanding and affecting overall health. But we see here that irrespective of having health insurance, many of our families did have challenges accessing other aspects of health, which gets at a more systematic or like systemic problem, and we need to try and move away from the focus on it being just healthcare services. Related to that, the third bullet point here, like the medical service delivery were least affected compared to social and therapy services, which also tells us that we should probably invest more heavily into these other services which are traditionally neglected. And then educational services, while not everyone was happy with the remote setting, I think it's really important that we develop best practices for remote learning, because in the absence of options to potentially go to school, we may be relegated to a remote learning environment, and it's best that we just become well versed in delivering educational material through the remote setting. And then let's see, investment in family mental health and physical health was came through pretty significantly through our survey, that family members were in fact dealing with other mental and physical health issues in addition to fulfilling the educational needs of their children. And the family unit characteristics might predict which families perform better, like in terms of organizing activities within the family, or believing in some higher power potentially. In the interest of time, I'm going to just wrap up real quick. So our next steps are outlined here. We need to do for the analysis, and Denise already mentioned that we were going to do a follow-up survey, and I will open it up for questions. I apologize, there are not too much time, but I think you can take over this for question time, Q&A time. Maybe we skip the poll and ask questions if they've already come through.
Okay. Thank you, Candace, Denise, and Priyanka.
Sure.
That concludes the presentation portion and begins the Q&A session of today's webinar. As a reminder, you can submit your questions through the questions pane in your control panel. Our first question is, I have a recent diagnosed 6-year-old girl with ASD level 1. I don't know where to start, but how can I apply to the next survey? Does it matter if I live in Ecuador?
I think we can, I will take this question. I think we can get your contact information, but as I briefly mentioned, the survey was tended to be very focused on the Southern California population because the school services and the type of services that are provided are kind of like probably unique based on your school district and where you live. So that's why we kept it that way. But there may be resources that we can provide you with from our team, not necessarily this survey, that may be beneficial to you. So yes, please feel free to contact us and we can get things, moving along, make that connection.
Wonderful. Our next question. What was the biggest challenge for you and your family during the COVID-19 pandemic?
That's a great question. Yeah, I think it's our due diligence to share what challenges we had since we asked you as well. I guess I can start it off and say the isolation component was more intimidating than I realized. I think that for my family and I, we were just trying to stay safe and get through, the whole process. But once we started to open up and be exposed to the world again, I realized that I had a mental health shift because I have strong reactions to seeing other people and interacting with other people. I do believe that I had some kind of baseline depression or some symptoms that I didn't even realize until I improved and started to see others. So I would say that piece for myself and my family.
Yes.
Wonderful. Next.
Yeah.
Oh, sorry.
Yeah, you can go ahead and go to the next question if you want.
No,
I know
please. No, let's hear from everyone.
Oh, yeah. I guess for me, I think the social isolation was a big one. I think it was also, I have young children, so dealing with them not being able to see their family and kind of struggling to comprehend, especially for my my 5-year-old, why life had suddenly become so very, very different, was exceedingly difficult because I didn't have very good answers for him. And I think I do a lot more community-based work now, but I trained as a physician, as a clinical physician, as a pediatrician. And I also felt, and I think a lot of physicians who have kind of ventured off into other realms of healthcare and healthcare services that aren't so typical, I felt a lot of guilt about not being involved as heavily in sort of the first line response, I think. So that has been kind of like an interesting point of reflection for me professionally as well.
Yeah, I think I briefly will say similar things like the social isolation, having a young kid, also like childcare, juggling childcare between two physician households, which had to, like, we had to be at work, so we had limited flexibility, but we were kind of like dependent on like, the daycare being open, and I really feel like blessed in that sense that we were able to access those services, which I think was a big privilege for our family. But yeah, similar things that Candace and Denise spoke about.
Before we go to the before we go to the next question, I just wanted to share with everyone that we created an emergency preparedness toolkit that's in your handouts that you can download. There's an English and a Spanish version just to help you all prepare to help our families prepare, because we found that that was also very helpful in addressing these issues. And you can go to the next question now. Just wanted to give everyone a chance to download it if they'd like to access it.
Wonderful. And I think we have time for one last question. What are the main issues you believe have affected families of children with neurodevelopmental disabilities during COVID-19?
Yeah, I think I can take it briefly. I think the two main themes were the educational, like meeting the educational needs and balancing that with what was possible at the time, because a lot of things were just not possible given like the stay-at-home orders, at least here in Southern California. And two is like maintaining your own personal mental and physical sanity while you're trying to deal with either your other family member or the child's the affected or the neurodevelopmental developmentally disabled child's needs. Just balancing that balancing act became so important, and we realized that as physicians, when we were seeing patients or like hearing about these stories, that we as a society don't necessarily do well in like offering support to family members and think of people as like just individual units. So how, when we all put together, how do we support each other? What are some of the things we should be looking into? Yeah, that's something that came out through the survey, at least. Yeah.
Wonderful. And I think we have one more slide before we close out the program.
Yes, there were multiple people, members, and team members who are not present today that we would like to acknowledge. Members from our pilot grant team, that's the LCIRN research team, members from the Autism Intervention Research Network, the AIRP network. Denise mentioned about the Joy Foundation and Lupe, who we had our conference with. And then, of course, our boss, Alice, Dr. Alice Ko, and a real leader and inspiration in this field, who brought all of these different pieces together for us and has been mentoring us. So yeah, thank you to everyone.
Wonderful. Thank you, Candace, Denise, and Priyanka. And thank you, everyone, for joining us today. If you found today's event helpful, we encourage you to register for OAR's next webinar event, Preparing Young Adults for Employment, on October 14th at 2 p.m. Eastern Time. At this time, we would also like to share information about a new community grant opportunity co-hosted by AIR-P and OAR. We have partnered together to fund resources that aim to promote the overall physical health and quality of life of autistic individuals. Members of the autism community can apply to receive between $1,000 and $10,000 to support the design and packaging of resources. The application period will open next Friday. For more information, download the handout and check out the full request for applications when it is released on OAR's website on October 8th. Once we close out of today's event, you'll receive an exit survey. We would appreciate it if you would complete that and provide your feedback. Everyone will receive a follow-up email with a link to today's video recording and materials within the week. On behalf of the Organization for Autism Research, thank you for joining us and have a great rest of your day.
Thank you so much. Bye.